What is TasP? What is viral load and viral suppression? What is ART therapy? What is undetectable equal untransmittable? We will deal with all these questions in this video. Stay tuned. Hello, my name is Ibrahim from Sofra Cologne. Sofra Cologne is a self-organized group from and for LGBTIQ refugees. On behalf of Deutsche Aidshilfe, I present to you a series of videos about HIV, AIDS and safer sex. In case you didn't watch the first two methods of the condom and the PrEP, please go back or add to watch later. Treatment as prevention refers to an HIV prevention method that uses antiretroviral treatment, ART, to decrease the risk of HIV transmissions. People with HIV take HIV medication to stop the virus from replicating in the body. If viral suppression is achieved, HIV can no longer be transmitted during sex. If you have HIV, it's important to start treatment with HIV medication, ART, as soon as possible after your diagnosis. If ART is taken every day exactly as prescribed, HIV medication reduces the amount of HIV in your blood, which is called viral load, to a very low level. This process is called viral suppression. It is called viral suppression because HIV medication prevents the virus from growing in your body and keeps the virus very low or suppressed. If your viral load is so low that it doesn't show up in a standard lab test, this is called having an undetectable viral load. People living with HIV can get and keep an undetectable viral load by taking HIV medication every day, exactly as prescribed, including regular viral load tests to ensure that viral load stays undetectable. Almost everyone who takes HIV medication daily as prescribed can achieve an undetectable viral load, usually within 6 months after starting treatment, which means that there are almost no viruses in the semen, vaginal fluids, or body fluids and mucous membranes, so HIV is not transmitted during sexual intercourses. There are important health benefits to having a suppressed viral load or undetectable viral load. For people living with HIV who know their status and take HIV medications daily and prescribed and get and keep an undetectable viral load can live long, healthy lives, as well to a major prevention benefit of undetectable viral load have effectively no risk of sexually transmitting HIV to their HIV-negative partners. As well, if an HIV-positive pregnant woman takes HIV drugs as prescribed throughout the pregnancy, labor and delivery, and if HIV drugs are given to her child for 4 to 6 weeks after birth, the risk of transmission from pregnancy, labor and birth can be reduced to 1% or less. Treatment as prevention is based on taking ART medication every day, maintaining undetectable viral load for 6 months, and continuing to take medication without losing doses. Undetectable equal untransmittable. Undetectable viral load for most clinically used tests, this means less than 50 copies of HIV per milliliter of blood. ART medications are not only good for your health, they also protect your partners with undetectable viral load. There is no risk of HIV transmission during sex even when you are not using a condom. Remember, treatment as prevention does not protect you from contracting other sexually transmitted diseases. The best thing to do is make an appointment at a doctor clinic who is specialized in HIV treatment. There you will be able to discuss what you can do to improve your health, which medication you will need to take to treat the HIV infection, and how you can avoid passing on HIV to others. You can obtain the addresses of such HIV specialist doctors from AIDS services organizations. Your health insurance fund will cover the cost for the medication and for examinations required. Treatment of an HIV infection is also covered by the Asylum Seekers Benefits Act, which means if you are an asylum seeker, the cost of the treatment will be covered by the state. If you do not have legal papers, speak to a clearing offices or an aid services organizations or a media bureau so that you can nevertheless get help. These institutions will offer you anonymous advice. You will be able to clarify the possible options for getting treatment for your HIV infection. You can check the following link appearing here on the screen for a list of counseling centers and their addresses. Please check out the following safer sex methods and choose the one or the ones that suit you and your situation best. Of course, you can combine several methods. Do not forget to share this video on your social media or recommend it to your friends. Sharing is caring.